In this video, I want to answer all of the questions about ADHD medication that you have asked me so far. I have them on my phone, so let's start with the first one. I recently found out that the fluctuation in hormones when menstruating can cause the symptoms to worsen and the stimulants to become less effective. After talking to my nurse about it, she gave me extra medication to take during PMS. Have you had any experience with this? Yes, I have. In fact, the same thing happened to me. I also received a higher dose, and my doctor said this is normal. She does it for most of her female patients, and I think it should be part of the equality etiquette for treatment because, yes, the symptoms get worse. This is a scientifically proven fact. Do you deal with self-blame? I only started taking the medication for less than a month and will be increasing my dose after talking to my doctor. I guess I have a fear of still being a failure, even with extra help. Am I trying hard enough? Is the bad productivity just my fault? It seems like I'm trying, but I can never say for sure. I dealt with self-blame a lot, and then I started this channel. I spent literally days of my life digging into ADHD research. After reading all of these things, how hard it is for us to keep a job, how hard it is for us to drive, that we have a 13-year less life expectation than other people because of accidents, I understand that I am not to blame. This is a very real thing. It is an actual problem and it is very difficult to deal with. So I don't personally deal with self-blame. In terms of trying hard enough and the bad productivity just being your fault, I think it's important to remember that we are an assortment of chemicals and neurons and all those things working, and there is no way this is going to be the same for everyone. It's really not a good thing to compare each other, but of course we do it. It's the most human thing. But if it works for you, you don't need anybody's approval. Do you ever feel wired or over-medicated? I definitely think while I was adjusting from the 30 milligram dose to the 50, I had several days where I felt wired. I was a bit more angry towards the end of the day. I didn't really have the cardiological symptoms, the physical things from the beginning, but mental things. So anger, anxiety, just feeling like, oh, I have to get everything done, but not anymore. I don't think it should be a everyday thing. I think it's an adjustment phase thing. What about comedown? I haven't really felt it. It may be the kind of medication that I have. It's very soft. I try to drink decaffeinated coffee so I don't crash at the same time from my medication and from coffee, and afternoon exercise because that boosts your energy a little bit so you don't crash necessarily. I think if you do those things and do the exercise right before you would normally crash, it softens it a little bit, but it's not that bad for me. Do you feel less fun and spontaneous? Kind of. I can definitely tell when I haven't taken my meds. I have a few more ideas, a few more funny jokes, but it's not that I don't have them when I'm medicated. They're just not as impulsive and as random at any unexpected time. If I sit down and if I try to be creative, I definitely still can, but it's not a spur of the moment thing. What are your side effects and negatives? I don't have that many side effects and negatives anymore. I did go through many in adjustment phases. Like when I increased my medication, I had a little bit more anger issues, tiredness issues, but now I really can't think of anything bad. Do you take breaks? No, I don't. It's not recommended, but I don't judge anyone who does. I know that after a break, maybe you feel it a little more. So if you prioritize your work over everything else in your life, you can take a break on the weekend and then do a better job when you come back. But I actually think my life and my work are both important, so I don't take breaks. Also, sleep, and I think not, but I can fall asleep much faster. I do use my day much more productively. I do exercise very regularly now, so I think that really all contributes to me being able to fall asleep. And about the other thing, I don't think I've noticed any difference, except maybe that I don't get distracted while it's happening as much as before, which is of course much more enjoyable. Did you have any prior issues with fatigue? Yes. Oh, I don't know why, but my energy was really unpredictable. It must have been a mix of the destroyed routines, horrible sleep, random working schedule. I think that's got much better, but let's be honest, it's never going to be perfect. So I honestly still have really really bad days where I'm randomly not good for anything. How has your conversation skill been affected over the last year? I think that has massively improved because I'm not a good listener. There is way too much going on in my head for me to listen to a very long monologue from the other person. I also notice how people are feeling more. I don't know if that's just a me thing, but I'm just not very empathic. I don't have the time to stop and think how the other person is feeling. I feel like I just want to pour all of my ideas on them. I want to feel how they are by hugging them, by asking them, but not really by paying attention to the cues. That's a little bit better now. But I still have a lot of problems with ghosting. I struggle a lot to answer my messages, though I have gotten much better. Did your friends and family members also notice a difference? I can have very good conversations, and my partner says he notices a lot that I am more present with him and more caring. So maybe, I think so. Have any of their opinions on ADHD or using medication changed, shifted since? My family is still very much struggling with this information. For a lot of people, it is invisible, and therefore you're just fine. Just as people wonder, is it my fault that I'm not as productive? Other people think the same. It's your fault that you're not productive. But it is very much a real thing, and I think it takes a lot of time getting to know your ADHD, reading the science, understanding how much of an implication it has until you start to understand this yourself and then over time communicate it to others. And eventually they will notice. Anybody else get really sensitive to smells while on vyvanse, or is it just me? A lot of people have reported that many of their senses are much more sharp or heightened when they are on vyvanse. Light sensitivity, noise, smells, anything. I definitely notice the light sensitivity in me. I try to wear glasses every time I'm outside. I also wear a hat these days, and I think I'm more sensitive to noise as well. And I try to plug my ears with some loops or noise canceling headphones. My primary struggle is at the end of the day when the meds wear off and I suddenly feel bad. What was your experience with the evenings? I think I try to push the hardest parts of my day earlier and then have some form of going outside or yoga just as the meds are running out. And then I don't notice the evenings being that bad. Also, it improves over time. So if you don't crash as bad, the evening isn't as bad. So it's really about being careful with sugar, with coffee, with your sleep, eating. It's just so important to take care of your body physically properly for the meds to work. Before saying they're not working for me, one should really try to optimize all of these things. I can't stress how much of a difference it makes. How did you take your meds an hour before waking up? Weren't you sleeping? Yes, I was. I used to set an alarm an hour before waking up, take the meds, half asleep, and then fall asleep. And from the medication and from my alarm, I would wake up an hour later much more energized. It just started ruining the last hour of my sleep, and then I stopped doing that. But this is a really good trick if you have to be really ready really early on in the day. How do you handle the afternoon crash anxiety? Walking. Walking is so helpful. I feel that my heartbeat increases a lot after I take the medicine. I'm taking another one to fix this. Days I feel good, others bad. Do you go through this too? Yes, I did in the beginning, and I actually have a very sensitive heart. I've had a lot of problems in the past, so I take a daily multivitamin. I try to eat good, sleep good. As I said, I drink decaffeinated coffee. I sometimes mix it with regular coffee depending on if I need a little boost of energy. Whenever I feel that I'm sensitive, I will not drink the coffee and I will not do really hard exercise. And I think it has been much better since I have been very careful with that. So maybe that helps you too. I hope nobody hates me for this, but I think cardio helps. I haven't done much of it though. How do you deal with the awful crash that occurs after a few hours and all the anxiety and loss of appetite and the insomnia? How are you able to continue? I'm not a doctor, I'm not a specialist, but I would say if you're not feeling absolutely horrible, if you're going slowly, you're not upping your dose just from 0 to 50, stick to it. Stick with it. See if it gets better. 3 or 4 months, I would say, is when I really noticed the leveling out of all of the negative side effects. If it's not terrible, talk to your doctor. How long did it take for the insomnia to go away? Probably a month. If you skip a day, do you notice that you sleep a lot that day or feel really down? This type of medication takes about 2 days to completely leave your system. So if I just skip it for 1 day, I'm still 50% of what I would be with medication. It's not that bad. But on the second day, and especially on the third day, I feel very tired. I want to eat the whole world. So this has to be planned, again, really carefully with sleep, with proper nutrition, water, everything. Definitely a difference since you're suddenly missing a lot of dopamine. Do you take the weekends off your medication? And if so, do your cravings come back? I don't take the weekends off, but I think that's why some people can take the weekends off, because 2 days is still in this kind of area where you have some medication in your system and you're not going to react really terribly to not getting it. Did you ever consider a booster dose? Since the effects on average last half a day, they could last up to 16 hours with extended release medication. So in that case, if you do take a booster dose, it might be too much. So I personally haven't considered it just because of those days. If it were to get really bad and I would notice that the afternoon is not working, I think I would probably look into it. Is it costly to have ADHD meds in Germany? I have a health insurance and for me it costs €7, but I know that it's very pricey in some countries. I believe in the US you have to pay yourself sometimes, and then it's impossibly pricey. Can't imagine what that's like because I probably wouldn't be able to afford it then and my life would be just terrible. Maybe I would get really into poverty. I don't know. I think that's horrible that they make it so inaccessible. The stigma and the bad knowledge on ADHD out there is really not helping. So we have to advocate for this. This needs to improve. Have you upped your dosage? What was your experience with it? What amount best supports your functioning? I started with 30. It was not the best around 2 months in, and I upped to 50 milligrams. I think that's the best, and I would be ready to lower because I know that the optimal dose is the lowest dose that works for you. It's not more means more effects. It's the lowest dose is optimal. And some days I do feel that taking a little bit less would be helpful. Did you get feelings of emotional numbness or apathy when you first started? Did it go away? Maybe, but it was more of a calm. I felt so much more in tune with myself, like I could finally pay attention to myself, not just to my thoughts and what my brain has come up with right now. Some could call it emotional apathy and numbness. For me, it was just pure serenity, and I honestly miss it because it's subsided much better than without medication, for sure, but I need to work more for this effect. Don't worry about it too much, it goes away, and if you can, make a good thing out of it. Have you seen an improvement with your memory? I have had this question a few times, and I think that some people get this. It might be more of a thing of mindfully clicking save in your head and then being able to retrieve it, because otherwise you just probably didn't notice and that's how you forget. In that way, yeah, my memory has improved because I do take a lot more mindful action throughout the day. I still forget a lot. I honestly write down everything, but I think it's a bit better nowadays. Is it totally fine to run or do sports while the medication is active? I read that it might not be as good for your heart, and some people do it before they take medication. Heart problems are a really serious issue with stimulants. If you have too much of blood pressure and heart rate, we should really pay attention to what the medication is doing, because of course it is also working on your heart. If you normally have a bit lower, then maybe it's okay, but still, just to be safe, I would do cardio and harder sports on the heart in the afternoon. That's also helpful in softening that afternoon crash, so it's a double bonus. Now, I think what might be really helpful is this video where I talk about what if nobody believes you have ADHD. I do discuss a lot of the imposter syndrome things in here, really useful information, or just checking out my 1-year medication update. That is also really, really interesting.